I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. Our guest today is Sharon Gomez. Welcome, Sharon.
Thank you, Craig.
So we share one thing in common. We're both from Louisiana. How about that? So I'm from a little town called Mansura, and you're from?
Originally from Plaquemine, Louisiana, which is just south of Baton Rouge.
I went to LSU.
I went to LSU,
well,
too.
How about that? We share that as well,
Go
too.
Go Tigers.
There you go. There you go. There you go. So Sharon, you work in the field of supports and services for people with intellectual and developmental disabilities. Tell us a little bit about, first, how did you get started in this field? And then we'll come to what you do now.
Well, it's a heartwarming story, at least I think so. Back when I was in junior high school, my best friend had a sister with an intellectual disability, and their mother was involved in the ARC. And so
the ARC is an agency.
At that point, it was called the Association for Retarded Citizens.
Yeah, and we've changed our nomenclature quite a bit for good reasons.
Right.
Yeah.
So now it's just known as the ARC.
Yeah.
And so she started a youth chapter of the ARC at our school. And so one of the things that we did was we had parties for the kids in the special ed class in our school. And I just got hooked.
Yeah.
And so I went on and belonged to that organization throughout high school and on into college. And I became the national president for the Youth ARC at one point.
That's a cool transition.
But it was something about the fact that folks needed support and that I could provide whatever support that they needed. And it was just the opportunity to engage with people that learn differently and to be a part of their lives, and for them to allow me to be a part of their lives. Because I have to tell you that I learn as much from people as they learn from me. And so it's just always been a part of my heart. It's my passion. And so anyway, graduated high school, went on to LSU, went to college, and got a 4-year degree. And then when I got out of college, I couldn't find a job in the field, so I did some other type work for several years, 3 years exactly. And then I got a call one day from a man that had been involved in the ARC as well. And his mother was running one group home in Spring Hill, Louisiana, which is in northwest Louisiana. And they were looking for an administrator because they needed their mother to retire. So he said, "What do you think?" And I said, "Well, we can go up there and look." And so we did, and I stayed. And I did that for a while, and then I got a call from a man that I had met that worked for state government in Louisiana, who had transitioned to an ARC in Thibodaux, and he was looking for somebody to run his residential program, and so I moved to Thibodaux.
That's South Louisiana.
Yes.
Yep.
And I did that for a while. And while I was working for Lafourche ARC.
And then Lafourche is a parish, by the way.
Right.
Yeah, we have parishes in Louisiana, not counties.
We have great government in Louisiana. We were serving a group of folks called Gary W. class members, which was a class action lawsuit that took place in Louisiana many, many years ago when people were sent to Texas to receive services. And while they were there, they were subjected to some really awful, abusive conditions, which Gary W.'s mother filed a class action lawsuit, and the terms of the suit were to bring people back to Louisiana to receive a prescribed set of services for a period of 18 consecutive months before they could be dismissed from the suit. Louisiana didn't do a whole lot of that for a while, and then they hired a special master to come in and help urge Louisiana forward.
And you know, the lawsuit thing is not unique to Louisiana. These happened in a lot of other states as well too. And the I guess the fight was really for people to be seen as people and to receive appropriate supports and services, right?
Yeah, and Craig, you know, one thing that I think is unique about the lawsuits is that it really serves to spur states on to do things in a different way and look at people in a different way. I can speak from Louisiana, from the standpoint of Louisiana. When this lawsuit happened, it was really the beginning of our community services system.
And that's true for a lot of the places where it did happen.
And so I got to work for Sue Gant she was the special master, and I got to work for her for 2 years as a court monitor, and went around making sure people were getting the services that were prescribed for them. And my caseload was primarily people with complex medical and physical needs. And so I had a caseload of about 150 people.
That's a big caseload.
All over the state. Yeah. So we did that for a couple of years, and then there was rumors that the lawsuit was going to be dismissed. And so then I started looking for a job, and that's when I went to work for Evergreen.
Okay, so Evergreen. Tell us about Evergreen.
Evergreen Life Services is a large multi-state provider of services and supports for people with intellectual and developmental disabilities. We serve people in 7 states: Louisiana, Texas, Oklahoma, Arkansas, Tennessee, Kentucky, and Florida. Louisiana is our largest base of services, accounting for about 60% of the services we provide, the people we support, the staff we employ. We are an organization organized in 1959.
Wow.
Have a formal affiliation with the Presbyterian Church, so we are a faith-based organization. And so I've done a variety of roles for Evergreen. I was a program supervisor. I had a caseload of 5 homes that I oversaw the services of the folks that lived in those homes.
So Sharon, we talk about, or I like to talk about health and wellness for people with IDD, and you've got experience working with people with significant and complex medical challenges. And in the work that you do now, what are some of the challenges or barriers that you see related to people with IDD getting health services that they need?
One of the things, right now, one of the things that is crucial and hard to find, for the most part, if you serve folks with complex medical needs, you've got to have really qualified nurses and really qualified physicians
Mm-hmm.
who have an understanding, besides the medical piece, they have to have an understanding
The bigger picture.
They have to have an understanding of intellectual disability.
Yeah.
So the types of medical services that you would provide in a community home for folks are very different than the services that you would provide in a hospital.
Sure.
Or a medical clinic. And so
that point right there is my passion. When you talk about passion that we have in this field, I started working in this field in the 90s and knew nothing about how to provide health care to people with IDD, and I became responsible for a large group of people with very complex medical and psychological needs. And I learned very quickly that I was not prepared to provide health care for people with IDD. And I think it's still the case, unfortunately, while there's been some improvement, that most health professional training programs like nursing schools and medical schools and dental schools and others, while there, again, is some improvement, there's still a long way to go in terms of educating students about this field. And it is so important and it's so valuable so that people with IDD have an opportunity to have equal access and equitable access to health care that they need. Does that resonate with you any?
Oh, absolutely.
Yeah.
And I will say that where I got my passion, if you will, for people with complex and medical and physical needs was when I was working for the special master and I encountered a woman named Karen Green McGowan.
I know Karen quite well. She happens to be really the founder of Intellectability.
Well, and she taught us quite a bit about how to understand that there are unique needs for those folks, and you have to stay on top of, because any little thing can go wrong. And she taught us so much about the physiological needs, especially of people who have, very physical needs, and how sometimes the contortions of their body affect
their ability to swallow and to eat, and bowel movements and bowel elimination and all of those things which are so important. And I think one of the things that Karen and I have talked about these so much, and we occasionally still do training together, but recognizing the differences in the way that certain conditions might present in a person who has a difficulty communicating with words, for instance. They still communicate, but maybe it's through some adverse behavior. And if we don't understand those things, we might end up putting the person on maybe a behavior medication for this behavior, whereas they might actually be experiencing some painful or uncomfortable medical condition that could be remedied with the right treatment and improve their quality of life, reduce health risks that they might have. That is so important and so valuable. And that's, when we talk about educating clinicians who work in this field, that's the kind of thing we're talking about. Mm-hmm. It's not just saying, oh, well, for instance, this is Down syndrome and it's trisomy 21 and it has these features. It's all about the different presentations in some of the common medical conditions and being aware of how, say, aspiration pneumonia might appear differently in a person with a disability than in a person without a disability, and it might be some sort of behavioral type presentation. Mm-hmm. So yes, that education component is so important for everyone who works in this field, especially the frontline staff, because they're often charged with having to recognize those early signs, which can make a huge difference.
And Craig, that's one thing that I was going to say that we learned so much from Karen, is that we have to rely on and educate our frontline staff to be attuned to those signals in folks and keep accurate documentation of those signals, because that's the documentation that you present to physicians.
Right. To help them recognize that there is a problem.
And then the other thing is, before you put somebody on a medication for what might be behavioral or might not, you need to rule out all medical concerns at first.
Yep. Completely agree. So I bet Evergreen does a good job of that with you being there.
Well, I certainly try hard, but I'm not alone. We have a phenomenal team of professionals, and one thing that I think is unique about a lot of our management team at Evergreen, many started out as direct support staff. Many of our regional vice presidents, many of our state directors got their start as direct support professionals.
You know, I love that you said that, because one of the things that we talk about on this program is the field and working in this field, and the value of working in this field and the rewards of working in this field. And you can start, as many people have, as you just said, as a direct support professional. And there are opportunities to grow and to expand your knowledge and your experiences and work in other areas of this field. It can be a career and not just a job.
Absolutely.
Yeah.
And that's what you really want. That's what really impacts the future and the fulfillment. Fulfillment's probably not the right word, but that's what impacts the future and of a company. I mean,
yeah, having people in it who get it, who've been there, right? Yeah.
And have worked their way to different positions. That keeps a company growing and thriving and moving forward.
Yeah.
I mean, anybody can, if you have a vacancy, can bring somebody in from the outside that doesn't understand your business, but that really impacts and stunts your growth. To have a career ladder for folks, and I will say that I think Evergreen does that well.
That's great to hear. So Sharon, we're at the American Association on Intellectual and Developmental Disabilities Conference, and I understand you've played a role in this organization before, right? You were a past president, is that right?
Yes, I actually played a number of roles. I got started, I've been a state chapter president, I was a regional chapter president, and then I was a national president. I think that was 2011 through 2012.
So tell us a little bit about the organization.
It's a fantastic organization. It's my professional home and has been for over 30 years now. It is an organization composed of researchers, university people, practitioners like myself, and all engaged in helping people live the lives that they choose to live.
Yeah.
And so the research that people engage in helps to set that practice in place. AAIDD did you know that AAIDD was over 100 years old?
I did know that, actually. I don't know the exact number, but is it the oldest organization in this field? Certainly one of them,
yes,
if not.
It is the oldest interdisciplinary organization of professionals, and it is an organization for professionals in the field, and that can be defined loosely.
Sure.
But it's an organization of professionals concerned with people with intellectual and developmental disabilities.
So what would you encourage listeners out there who work in this field to become a part of the organization?
Oh, absolutely.
Yeah.
You will learn, and you will grow. You will be able to network with some of the brightest and best people we heard this morning from one, Ruth Luckerson. You get to meet people who have written books, who have conducted state-of-the-art research.
Great organization to be a part of.
Absolutely. I would encourage anyone who's not a member to become a part and participate in our conferences. If there's a number of different interest networks that you can get involved in, and just network with people and
excellent,
and share practices.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support. So Sharon, we've come to the part in the show where I do something called 3 in 3. So it's 3 things in 3 minutes that you would like to tell our listeners about this field that you think are important for them to know, or things that you think can improve overall health, wellness, supports, and services for people with IDD.
Okay. I can say it in 3 words.
Oh, all right.
And they're all the same word.
Okay.
Community, community, community. And I don't just mean physical community. You know, we're all involved in a number of communities. But community is what we bring together and what we bring to the table for other people. And community is where all of us are. Mm-hmm. And that's what we should want for those we serve as well. To be a part of, to be contributing members of, and to be valued members of the communities in which they engage.
So Sharon, thank you so much for taking the time to talk with me today, and more importantly, for the amazing, incredible work that you do in this field.
Thank you, Craig, for the opportunity.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.